Yes, I am Dr. Rohan Patel, practicing as a diabetologist since last 13 years in Bharuch city at my own clinic, diabetes clinic.
How does Imeglimin fit into your regular practice with the current landscape of T2DM treatment options?
See, this is basically a new approach where a mitochondrial dysfunction has been addressed. So, as an add-on therapy, this molecule is doing wonders, and it is a new pathway which was till date unaddressed. And by using this molecule, we can have a better glycemic control with some vascular benefits.
In what specific patient populations do you see the greatest benefit of using Imeglimin?
A patient who is on conventional diabetes treatment still not meeting the HbA1c goal, using this molecule help us reach to the HbA1c goal, or already who are on at the HbA1c goal but due to multiple dosages of the medicine and a more amount of insulin required to address the insulin resistance, adding this molecule will reduce the pill burden. It also helps in making glycemic variability little bit less in my practice. And mainly the GI intolerance patient, the metformin is a gold standard treatment everywhere. So whenever there is a diabetes, there is always a lifestyle followed by metformin. But some patients in day-to-day practice who cannot tolerate the metformin, this is the one of the good option.
How does Imeglimin compare to other hypoglycemic agents in terms of safety and efficacy? Kindly share a real-world case if any.
Okay, so Imeglimin, if we talk about its safety, so it is very safe to use. CKD, CLD, everywhere we can use it, and it is having action like metformin, but metformin is not a sort of insulin secretagogue. So using Imeglimin will address both the issue. It will increase the insulin secretion as well as it will address the insulin resistance issue by and also helps reducing hepatic gluconeogenesis. So efficacy wise, it is a good molecule. Safety wise, it is safe. It is also has been shown to improve nephropathy function in some of the studies, and so safety is not an issue with the Imeglimin, and efficacy is also not an issue with the Imeglimin.
In recent time, Imeglimin sustained release formulation with Indian study has been launched in India. What is your opinion on that?
Yeah, the sustained release formulation makes patient tolerability more. So as I said that when patient is intolerant to metformin, is already having some disturbed GI tract or sensitive GI tract rather I say. So using this molecule in sustained release form will ensure that this molecule is now GI friendly.
How does the mitochondrial targeting mechanism of Imeglimin influence its clinical use?
Mitochondrial action is basically the type 2 diabetes is been characterized by, if we see the molecular level, the mitochondrial dysfunction, and this is the first molecule in class which actually do its effect on mitochondrial dysfunction. So correcting the mitochondrial dysfunction is like correcting endothelial dysfunction, and it helps reduce the future long-term diabetes related micro and macrovascular complication. So when you walk on a route, the strength of a building will be much more powerful. So when we treat a problem with its root problem, so we get better results, and patient will have sort of less morbidity, less mortality when we thoroughly addresses all the issue, that omnious octet, that every issue which is responsible for the diabetes, and we address each and everything. So this was the missing piece, and now we got the one.
What are the key safety and efficacy findings from clinical evidences on Imeglimin that clinicians should be aware of?
It is that first of all, the highlight point is it is one of the best add-on in when the conventional therapy is not able to achieve a glycemic control. Secondly, no GI side effects. Thirdly, safety wise it is good. CKD, CLD you can use anywhere. No dose titration is required. The 200,000 mg per day is well tolerated, and other thing to keep in mind that it also help reduce the progression of diabetic nephropathy, diabetes related metabolic cardiomyopathy, and even neuropathy. So placing this molecule in day-to-day diabetes practice will give safety belt to a patient who is riding a car of uncontrolled diabetes.
Do you believe that Imeglimin has the potential to change the future landscape of diabetes treatment?
Yes, the research is going on, and finding the new molecules every day is the routine nowadays. But getting a imeglimin like molecule has opened a new research door for a better treatment of diabetes patients. So definitely this molecule have the stand in the whole right now that treatment regime, and it is showing its positive impact in clinical use. And I wish best of luck to Imeglimin that it should show wonders in future.
Any other key points or take-home messages you would like to share apart from this?
Imeglimin is, I think, right now is not the last thing to select. So whenever patient you are giving a standard treatment, so what I believe in my day-to-day practice that we should use each and every molecule in a specific manner to address all the pathophysiological factors. So imeglimin, no GI side effect, well tolerability. We can give as even in a diabetic patient. I have tried also on pre-diabetic patients and I got the results. So this molecule can be used right from the pre-diabetic stage to end kidney disease problem. So wherever you find a patient is having not achieving his goal, we should use this molecule. Whenever you find that patient is not adherent to the treatment due to frequent GI side effects, we should consider this molecule.